Good morning, or good afternoon, or good evening, depending on where in the world you're tuning in from. I wanted to welcome you all to the Wilson Center Africa Program's first virtual event. And to kick it off, I would like to give the floor to the President and CEO of the Woodrow Wilson Center for International Scholars, Congresswoman Jane Harman. Please, Congresswoman.
Thank you, Mike. Good morning and welcome to those joining from the United States. Good afternoon, maybe good evening to some around the world who are zooming in to hear on-the-ground perspectives from 5 African countries: South Africa, Libya, Ethiopia, the DRC, and Côte d'Ivoire, that are confronting, along with the rest of the world, COVID-19. I apologize that I am not I'm not there by video, only by audio. I've had a few technology issues. Some of you may suffer those as well. But I am told that we have an incredible 500 plus RSVPs for this event. We're humbled by your enthusiasm, which is a testament to how important it is to hear from regional experts during this unprecedented global crisis. Discussions like today's are the reason we've been named, we, the Wilson Center, the #1 think tank in the world for regional studies 3 times in a row. And I have to say, as the President and CEO, how proud I am of our Africa program led by Monde Myangwa and those who work with her on it. As the number of COVID-19 cases swells to more than 10,000 in Africa and over 1.5 million around the world, we hope you and your loved ones are safe, healthy, and in close communication. I've pointed out many times in our virtual events, and I'll say it again, the coronavirus particle is just 120 nanometers wide. That's small enough to fit nearly 600 across the width of a human hair. But it has taken a devastating physical, psychological, and economic toll in a matter of months. While the African Union has been working on a coordinated basis through the Africa Centers for Disease Control, it's important to acknowledge that the continent's 54 countries will not all experience the pandemic in the same way. Over 40% of Africans live in densely populated areas, which makes social distancing especially challenging in some countries. After the 2014 to 16 Ebola epidemic in West Africa, the continent has proven tools and strategies to fight infectious diseases. But it will still be hard to get the right resources to the right places, a problem we're having right now in the United States. Fortunately, Africa's young population means the continent could be shielded from some of the worst health effects of the virus, though we have to understand that young people are getting it too. The bigger toll will come in the form of short and long-term economic damage. Before COVID-19, Africa was home to 8 of the 20 fastest growing economies in the world. Well, to make sense of how the pandemic is unfolding in Africa and how governments and citizens are responding, we are joined today by an impressive group of experts from all 5 regions of Africa. These experts are all parts of the Southern Voices Network for Peace Building, something the Wilson Center knows well, and we thank the Carnegie Corporation of New York for supporting this project at our Africa program. Introducing our speakers and moderating our discussion is Michael Morrow, a senior diplomatic fellow at the center and a long-serving Foreign Service officer at the State Department. Mike brings a wealth of experience, having served in Iraq, Thailand, Botswana, Poland, Russia, Washington, Nigeria, and most recently as chargé d'affaires in South Sudan. Please join me in welcoming Mike Morrow. Over to you, Mike.
Thank you very much, Congresswoman Harman. Needless to say, over the last few weeks, things have changed rapidly across the world. And for us at the Africa program, it's crucial to keep the spotlight on issues and developments in Africa as this crisis unfolds. As the coronavirus spreads across the continent and African governments and its citizens respond, we're going to hear today about the situation on the ground from 5 distinguished speakers. But first off, I want to thank the Wilson Center's amazing audiovisual and external relations teams. They have worked hard to ensure that the Wilson Center is at the forefront of global developments and able to keep doing what we do best, in this case in virtual format. So thank you to the terrific AV and external relations teams. I want to point out that for today's event, we are live tweeting the event, and we'll also be taking questions online and via email. To join us, please tweet your questions and tag Africa Up Close and use the hashtag COVID Africa, or email your questions to africa@wilsoncenter.org. I'm delighted that joining us today are 5 colleagues from the Southern Voices Network for Peacebuilding, or SVNP. Each of them leads a think tank in one of Africa's 5 regions, and they are here today to present a continent-wide perspective of the spread of and responses to the coronavirus in Africa. The Southern Voices Network for Peacebuilding, many of you are already familiar with it, but for those who aren't, it's a continent-wide network of African policy, research, and academic organizations that are working with the Wilson Center's Africa program to bring African knowledge and African perspectives to the United States. Also bringing knowledge and perspectives to international policy and focusing on the issue of peacebuilding in Africa. The SVNP network is funded by the Carnegie Corporation of New York, and you can find more info on the SVNP at our website. So just a couple introductory remarks, and then I will introduce our speakers in turn. Over the last 5 months, the novel coronavirus has spread across the globe, and it's really disrupted the lives of millions of people around the globe. African nations were some of the last countries in the world to be reached by the virus. And for now, the infection volume and the rates remain lower than in most other regions. According to the BBC's Coronavirus African Tracker, as of this morning, the number of confirmed cases of coronavirus on the continent stands at 11,500, with 577 fatalities. Unfortunately, it's almost certain that will be an upward trajectory. The question is how far and how fast, and that's what we'll hear about today. Obviously, the coronavirus poses a great challenge to African nations. The spread of the virus will be hard to contain through the recommended social distancing measures, given the dense urban populations in many African cities. Also, the fact that healthcare infrastructures are under-equipped, and that information access lacks for many Africans, especially in rural areas. All of those are complicating factors as the continent deals with the crisis. The impact of coronavirus will be felt acutely for African economies as a global slowdown will impact the region. It'll also impact Africa's large informal work sector, and it will impact those populations in Africa that do not have adequate access to digital financial services. As national governments in Africa act quickly to stem the public health crisis, governance issues will arise as the various countries navigate how to combat misinformation and how to appropriately ensure compliance with stay-at-home orders. Despite these challenges, African nations have both deep resilience and invaluable experience fighting pandemics born out of efforts to combat HIV/AIDS and the Ebola virus and other recent health threats. The way that the coronavirus pandemic will play out across Africa will vary from country to country. It'll be impacted by the size of the population, the type of government, its readiness, the readiness of the health system, also current levels of stability, and many other factors. So what we're going to talk about today is what the current situation is with coronavirus in Africa, how are the governments and citizens responding, and what will be some of the effects in the near and the short term, socially, economically, and also in the peace, security, and governance realms. As I said, we have 5 terrific speakers here with us today to address this topic, and I will introduce them in order. Our first speaker will be Dr. Jonas Adaye Adeto. Dr. Jonas is the Executive Director of the Institute for Peace and Security Studies at Addis Ababa University in Ethiopia. Our second speaker will be Mr. Anas Elgomati. who is the founder and director of the SADC Institute in Libya. And I'll add that the SADC Institute is currently our sole Northern African representative in the Southern Voices Network for Peace Building. Our third speaker will be Reverend Eugene Guskinde. He is the Director General of the Center for Research and Action for Peace in Abidjan, Côte d'Ivoire. Fourth, we have Professor Cheryl Hendricks. She is the Executive Director of the African Institute of South Africa at the Human Sciences Research Council in Pretoria, South Africa. And finally, our fifth speaker is Father Alain Nzadi Anzadi. He is the director of the Center for the Study of Social Action in Kinshasa, Democratic Republic of Congo. So we're very fortunate to have 5 such distinguished speakers addressing us today. What I'll do is I will ask each of them to speak for an opening 5 minutes on how coronavirus is unfolding in their country. Also ask them to address the what is the pandemic's immediate impact so far, and how will the populace of their country in different areas, regions, different sectors, how are they responding? And then how has their government responded? What's working well, and what are the challenges so far? So with that introduction, we will lead off with Dr. Jonas Adai Adeto of the Ethiopia's Institute for Peace and Security Studies at Addis Ababa University. So Dr. Adeto, over to you, please, and thank you.
Thank you very much, Mike. Thank you indeed. I've got these 4 points to address in 5 minutes. So when I come to the first state of the art, what is up to now in Ethiopia, we have 2,496 cases tested, out of which 55 found to be positive, and two persons who were Japanese had to leave to their country, and 2 persons, of course, unfortunately passed away recently, and 4 persons recovered, luckily. If I focus on trajectory aspect, if really the test following WHO's instruction, test, we could really have more than that. So up to this point, we have 55, but if the test continued, it is quite possible to have more than that. The immediate impact could be expressed particularly in economic terms. As we can see from Ethiopian Airlines, over $500 million loss already recorded. And flour exports and most working, particularly private as well as public institutions, really have come to a standstill. And there are also laborers who live on a daily basis. They also really are facing problems. But socially, it also helped the other aspect of humanity, that we all have a limit. So people started to think, to reflect back and cooperate. Those who were focusing only on individualistic cases, instances, started to also think for the neighbors as well. So Corona not only maybe has negative but also positive aspect of bringing people together as well. And this social distancing has been replaced in Ethiopia, physical distancing rather than social distancing. So we don't say social distancing, but physical distancing, socially coming together, physically, of course, about 2 meters keeping away, while thinking of each other, helping each other. And when I move on to the third one, public response, it is mixed. The government is really trying its level best so as to raise awareness of the people. Yes, people started to wash their hands. Yes, they try to keep their physical distance without socially distancing from each other, because they have to pray for each other. In Africa, life is collective, cooperative. So they can't have that social distance, but they have the physical. So in that area, it has some hardship. And another negative thing is on people are told to wash hands, but if they don't have water, how can you help? People are told to stay at home, but if they don't have means to stay, what can they do? I think that's a challenge for global society as a whole, not only African situation. And the government response, it's been really robust to my understanding. Number one, it started to mobilize resources so as to provide with utility, particularly expected those equipment, particularly those sanitary sanitizers and masks, particularly for people who are working in the health areas. And also washing water, just supplying with sometimes tankers around as well. And secondly, also closing public gatherings as a whole, schools, universities, churches, mosques, all have to just start working from home rather than going to those gatherings. And state of emergency just declared yesterday because some people are not behaving according to the law of the land. So the government has started to regulate that behavior as well. And effective communication is also going on, particularly using religious leaders, media, social media, and traditional media, particularly using elders as well, going around doorsteps of neighbors. So in general sense, these are some of the points I wanted to raise with you.
Thank you, Dr. Jonas, for that very insightful and very succinct opening for us. Really appreciate that. What I'd like to do now is turn the floor over to Anas Algomati from the Sadek Institute of Libya. So Anas, over to you. Thank you. Anas, please unmute.
Is that better? Thank you. Thanks, Mike. Thank you to the whole team at the Wilson Center for hosting us today as well. So very briefly, I mean, Libya is actually a year this week into this anniversary of a third civil war in the last 9 years. So it comes, the coronavirus really has come at the worst possible time. Now, 9 years ago when the revolution began in Libya, the war kind of spread across the country in many different ways, and what people anticipated to be a massive clash in the capital city of Tripoli was largely averted. In August 2011, the Gaddafi regime fled and basically chose to flight as opposed to fight, and left behind in Tripoli a city that had been kind of almost in dire need of investment, but it was still intact. And the health system in Libya was still intact. Now, after 9 years, and particularly after the last year of the conflict, the public health system in Tripoli, its most densely populated part of the country, is really in dire need. And I think that's the first thing that really comes out at a time like this. The first of those that fell in the war in the last year have been paramedics, have been public health officials, have been those that are working on the front lines trying to save people from the war, and that capacity is now lacking. But only in the last 2 weeks since the beginning of what is now the state of emergency, according to the coronavirus, that was issued by the Government of National Accord in Tripoli, there has been an overwhelming amount of bombing and shelling by the Libyan Arab armed forces led by Khalifa Haftar from eastern Libya. Now, this is really the kind of the crux of the problem now. It seems like the cover of coronavirus, the fact that there is a global distraction by the coronavirus, is actually intensifying the conflict in Libya. That's really the damage that we're looking at today. Now, number one, the main hospital, the Khadra hospital in Tripoli, that has the most ICU beds, or the second most number of ICU beds in Tripoli, has been bombed and been shelled over 30 times in the last 2 days. There's a significant rise in what had been happening, and it hadn't been targeted over the last year of the conflict. But given this distraction, it seems like one of the belligerents, the Libyan Arab armed forces, are allowing themselves to kind of become excessive and to intensify their attacks on the very infrastructure that would save people from the coronavirus, or at least would treat people that has coronavirus. The second and most troubling element is over in the last few days, 3 million people in Tripolitania. This is the most densely populated part. Half of Libya's population live in Western Libya and Tripolitania. 3 million people have had their water cut. And that's a massive, massive dilemma because of a member of the Libyan Arab Armed Forces, or the mayor of a town that is affiliated to the Libyan Arab Armed Forces, has cut off the water supply to 3 million people in trying to barter and trying to pressure, amongst many of the demands, trying to pressure the government of national accord to kind of relinquish control and allow Khalifa Haftar's Libyan armed forces to progress and move forward. That's the most, in this troubling time, and I suppose in such, a nasty time, it's surprising that Libya has found, or the government of national accord have found the time to send 30 doctors to Italy to help them with their pandemic. Now, Italy's shores are only 300 kilometers away from Libya, and Libya is a gateway, an entry point for African migrants, for Arab and African refugees into Europe. It's the most commonly known migration routes in the world from those traveling to Africa into Europe. And I think that's really where I'm looking at the kind of the long-term dilemma here for many people that are focusing on Libya, is not only that what happens in Libya is important to Africa and the rest of the world, but most importantly for those that are looking at Southern Europe, at a time where Europe is approaching the top of the curve, as everyone is saying, and perhaps might begin to decline in numbers very, very soon. It could be the case that Libya's numbers are increasing and the migration and refugee numbers start to increase, moving from Libya into Southern Europe. And we saw that when that happened in 2015 and 16, it just collapsed Europe. There was a huge number of, a massive number of populist parties that came into power on the back of this movement last time. And I think the kind of hostility and fear and the way that that could be amplified and weaponized in the next couple of months, I would say, because this is seasonal and the summer months are really the number of months where this begins to amplify. If those numbers surge, if many people start to move forward and try to go and take those boats into Europe, I think that this could be catastrophic. And I think we would also see a sense of inhumane treatment to people that we haven't really seen before. And that's really something that I'm looking at in the long term here. But really today, I think the situation in Libya is disastrous. And I think it's one of those things that we had a luxury time to solve this problem in January. The world leaders met in Berlin. Angela Merkel hosted at least 10 different leaders from all over the world and senior members of governments from all over the world. And the political will was there lacking afterwards to really kind of stop this war from two angles, from the international backers that are supplying and providing the material support for this to continue, from the UAE in Eastern Libya and Turkey in Western Libya, but going forward into the belligerents on the ground, using sanctions to actually stop them from continuing the offensive, specifically to the Libyan Arab Armed Forces, the Khalifa Haftar, to actually stop the offensive and allow a ceasefire and humanitarian corridor, at least for those that need to be saved from the war, and also to allow the health system to recover and begin to treat patients for coronavirus. That's really where there was a luxury timing for this a couple of months ago. But this, we should be under no illusions. This will rip through Libya's population in a way that we have never seen before. And I think in North Africa, as the numbers swell in Egypt to over 1,500, to 600 to 700 in nearby Tunisia, that's also, those numbers are quite alarming. So I think this is a time now for the international community to really step their game up and begin to take this seriously.
Okay, thank you, Anas. Very insightful. I really appreciate that. We'll turn the floor over now to Reverend Eugene Gosekinde from Côte d'Ivoire. He, again, is the Director General of the Center for Research and Action for Peace, CIPAS. So, Reverend Eugene, over to you, please.
Thank you, Michael. The situation here in Côte d'Ivoire is really evolving day by day, and the numbers also seem to be going up most recently. As for Wednesday, the number is really 62 new cases and 323 tested positive, 3 fatalities, and 41 are recovered. But to really understand the challenge which the government and the people are facing, is good to put Côte d'Ivoire into perspective. Côte d'Ivoire is one of the very dynamic country in terms of economics, and it also belongs to ECOWAS, the West Africa Community state. And Côte d'Ivoire with ECOWAS is a free movement of people. And that's one of the very important parts if you want to understand the decision that will come on locking down, closing the borders. It has border with Mali and Burkina Faso in the north, border with Liberia and Guinea in the west, and border with Ghana in the west. And so the measure that the government has taken recently, are very important. They are very important. In a span of 10 days, I would say starting very specifically from March 16, the schools as well as the universities were closed. And the decision has also been taken that local residents coming from abroad and local Ivorian would be quarantined, and non-Ivorian would then simply be banned to enter. That is already on the 16th of March. Just a week after, on March the 22nd, the government decided that all the borders, land, air, as well as sea, would be closed off for passengers, which is an incredible task, in fact, to maintain. Then by the following day, on March 23rd, this big decision has been taken by the president. Is really the decree on the state of emergency. And with the state of emergency, the decision has also been taken to have a curfew going from 9 p.m. to 5 a.m. And restaurants and other selling activities little on the road were almost banned. The social distancing was installed, 1 meter, and by the 29th of March, the big decision for us here in Abidjan is that Abidjan has been somehow locked down compared to other places. You cannot go out of Abidjan to the countryside without a special permission. And mind, Abidjan, of the 25 million population of Côte d'Ivoire, have almost 5 million inhabitants. That's 1/5 of the population. So you can imagine the challenges that will come on lockdown, social distancing, and small-scale business. And the informal sector, which is a driving force of the economy, is almost hit by this measure. I think the government tried to do something more. It has mobilized almost $2 billion or more US dollars as a fund to temper. And my sense today, when we reflect on all these measures they have taken, is of 3 types, 3 basic challenges. First, how to set up a process of implementation that take into account a very strong strategy that will help those who are really in need to be the first beneficiary of the fund. Then there is a question of having a clear criteria of who would be the beneficiary of the relief fund and how the disbursement will be made, going from small businesses, poor people, and normal citizens that could not do their job anymore. And the last, and probably last challenge, which I've seen and have really repercussion all around already, is the question of communication. Communication has been, and still is, I would say, the primary challenge. Communicating to the population, the sanitary things, communication also of what the government intends. We do have last week almost a kind of riot when the government want to set up a center for testing and another center for treatment. Within the program, people rushed to the sites and almost demolished the site because there were a false communication going on that this may wanted to be impact on them because politically or others, and yeah, people react very strongly. I think the government is trying to do more now in terms of communication, and those are the challenges I'm seeing.
Thank you very much, Reverend Eugene. Let's give the floor now to Professor Cheryl Hendricks, Executive Director of the African Institute of South Africa. So thank you. Over to you, Professor Hendricks.
Hello everyone. Can you hear me? Good to be with you, even though these are very trying times for all of us. As you mentioned, Mike, the number of cases of COVID-19, people who have been infected on the rise in Africa. I think you said 11,500. Of those, 2,500 would be in Southern Africa, and South Africa has the highest number in Africa with 1,845 people testing positive for COVID-19. We have had 18 people die so far. Now we have a population of 57 million people spread over 9 provinces. Of those, only about 50,000 people have been tested to date. The first case of coronavirus, a person testing positive, was somebody returning from a holiday in Italy, and he tested positive on March the 5th. Since then, the number has just been increasing quite rapidly, such that by the 15th of March, we had a state of emergency being declared. And on the 26th of March, we went into lockdown, a 21-day lockdown. At that particular point, we had 402 cases. If we look at it just very briefly by province, Gauteng province has the most number of cases, followed by the Western Cape and then KwaZulu-Natal. It's very clear also that it started in the more wealthier areas. So Sandton, which is our wealthiest area, was the epicenter for us of this particular virus. And it makes sense because those are the people that are able to travel, visitors coming in, go there first, for example. The townships and rural areas are, of course, our main concern here because of the ability to spread very rapidly in those particular areas and the lack of access, as everybody has been mentioning, to water and proper sanitation. And that will simply just fuel the spread of this particular virus in those areas. But to date, we have actually had very few cases in our townships. We have in Khayelitsha and Alexandra and KwaMashu, but they still seem to be under like 20. And I think this is more because we have been waiting for people to come to testing centers before when they're showing symptoms. Now government has embarked on a different strategy. It has sent or deployed 10,000 people out into the townships to go and screen people for testing. And we'll see many more people then coming to the fore testing positive with that more proactive approach. I think that there's a general agreement that South Africa, our government acted very judiciously, acted firmly and very early, and that this has kind of slowed the increase of this particular virus. Predictions are that we will only peak in the first week of June, so we've still got a long way to go here. We're going to see this particular virus still spread into the townships. As you know, with the lockdown, all of our non-essential services have been closed. Essential services are open, but in our case, they've closed the sale of alcohol and cigarettes as well, which is quite harsh on people. Taxis, though, are still allowed to operate, and if anybody knows South Africa, many people, the majority of people actually use taxis and they're quite congested. So what they've done is limit the number of people who can be in a taxi and then obviously also try and sanitize people hands getting in, etc. Another interesting development, they first indicated that the spaza shops, these are in the townships, could not operate. And then they said that they could operate, but only small businesses who are nationally owned are allowed to open. So this is obviously a huge disadvantage for foreign nationals who have these small spaza shops as well. In terms of impact, obviously this is going to impact our health sector quite severely. We're beginning to see the signs thereof. One of our hospitals, St. Augustine, has had to close because more than 40 of its medical staff tested positive already for this particular virus. We have, as everybody knows, a two-tier system in South Africa when it comes to health. The more wealthy accessing private hospital care, which is up to first world standards, and then our public health service, which is challenged by a lack of resources, inefficiency, etc. And this particular sector will again be challenged here, I think. Everybody is complaining that there is not sufficient protective gear. Universities have jumped in to make masks. The private sector, in terms of foundations, have poured money in to purchase PPEs here. And I think that our government has approached Russia to also assist it with a strategy. Our testing is still taking quite long. Before, government was communicating on a daily basis the numbers. It is taking much longer now, every 2 days, to communicate those numbers to us. Our biggest impact would be, and is already to be felt in the economy as everywhere else. Production has halted. Many services are no longer operating. This is a country with 50% of its people being categorized as poor, with 29% of people, and those are just official figures, being unemployed. And so when you have a lockdown like this, unemployment is going to rise. So official statistics are saying around 370,000 will become unemployed, but people are saying more towards 1 million people will be unemployed after lockdown. It also brings out many of our social ills. And so, for example, we're seeing, and I'll speak to this a little later, an increase in domestic violence. We are seeing the actual number of homeless people because we have had to get them into shelters in South Africa. And that poses a whole lot of challenges as well. And obviously also the mental challenges on people who now have to stay indoors in very confined spaces.
Okay, Professor Hendricks, if you could wrap up, thank you.
Yeah, these have been our main challenges.
Thank you. Our last opening speaker will be Father Alain Anzadi of the Democratic Republic of Congo, Director of the Center for the Study of Social Action. So Alain, please unmute your microphone and the floor is yours.
Okay, thank you very much. So as some of you may know, in DRC, we faced another crisis before this one, the coronavirus crisis. We had Ebola, which ended 1 or 2 months ago. Ebola made more than 2,000 victims in the eastern part of the country. And that Ebola crisis, from my own point of view, was very well managed, at least as compared to the way the government has been managing the COVID-19 crisis. So as for a coronavirus crisis, the figures so far, we first had the first case was 1 month ago, the 10th of March. And so far we have had, as of yesterday, 207 confirmed cases. Among those, 12 are cases reported from the provinces outside Kinshasa. So the disease is focused mainly in Kinshasa here. And out of the 207 confirmed cases, we have so far 20 people death. That, I think, is the highest rate in the world. It's almost 10% of people who are affected by coronavirus have died. As of yesterday, we had 24 new cases. We have 4 fully recovered people. And yesterday, the government communicated that we have 119 cases of people who are on a recovery path, who will recover very soon. And we only have 36 people hospitalized, because most of those cases I've mentioned are being quarantined in their homes, because the government has not really put up a structure, a proper quarantine structure outside or somewhere in the city. I can see for this crisis, the government took the same team which managed the Ebola crisis to manage this one. But the team is being challenged by lack of resources, funds. And I can see a poor management from the government side of this specific crisis. Because first, as I said, they have not even put up a structure, a proper quarantine area structure in the country or in the city, Kinshasa at least. And there was a very late response in terms of closing the borders. They only did that some weeks ago. So currently, all the borders are closed. And Kinshasa has been quarantined. Nobody can go out of Kinshasa or come in, apart from people transporting goods. This crisis, I can see some impact, economic and social impacts and lessons that we can learn from that. It has shown that we really need, as a country, to improve the purchasing power of the people, because it has been very difficult to for the government to proclaim a total quarantine of the city, containment of the city, because people in Kinshasa, in the country, live mostly on a daily basis. So you cannot ask people to stay home, because then they will die for lack of food instead of dying for a coronavirus crisis. We also need to improve our health facilities and improve even the way we manage our agriculture, because statistics are showing that in a near future, maybe we may face a lack of food, and also improve the way the governance. Or the country has no money put aside for such crisis. There's no sovereign wealth funds. And then we have to beg and see whether people can come and help. So that's what I can say for now. And then I will come back to some of the issues later on.
Thank you, Father Alan. So we'll move now to the question and answer session. I want to thank each of the speakers for their very insightful opening remarks. And before I turn this, I'll pose the first question and ask each speaker to address it. But let me remind our online audience that they can tweet us any questions to @AfricaUpClose. Again, that's @AfricaUpClose, or they can email us at africa@wilsoncenter.org. So please do send in your questions. But I'll pose the first one, and I'll ask Dr. Jonas to address it first. First question is on regional integration and cooperation. The response to the coronavirus pandemic obviously requires regional cooperation. The African Union has set up a COVID-19 response fund to which several African countries have already donated. So the question I want to ask each speaker is, what are your countries doing to cooperate with neighbors with the regional economic communities and the AU to address COVID-19. I'll give the floor to each of you for about 2.5 minutes to answer this. So let's start with Dr. Jonas, please. Please unmute, Dr. Jonas.
And this pandemic in specific definitely requires collective response. And if I take my country's case, my prime minister had to make a deal with Chinese company, Alibaba, and of course, in cooperation with rest of, particularly with African Union leaders, have to bring extremely important equipment, which are very helpful for 55 countries across Africa as a whole. And it was transported to different areas. And this is just to start off. And then at IGAD, as well as East African Economic Community level, 2 days ago, and yeah, just yesterday evening, about $100,000 to each of 7 member countries. IGAD member has to share so as to particularly supplement those needy people who can't stay at home, who do not have basic those substance. So to provide these people with the water, clean water, as well as, of course, food. And this cooperation has got this regional impact. That is this regional cooperation, because for us, whenever we study security, we see it as regional security complex. So from that angle, it really also created another extremely important opportunity for Africa to come together in Pan-African spirit.
All right, thank you, Dr. Jonas. Let's go over to Anas to address the same question on regional cooperation. Thank you.
Thanks, Mike. I think it's a real challenge. I think it also exposes the difficulty that Libya has had with managing its relationships with both the African Union, but also across the Maghreb and North Africa more broadly, and into the Sahel. So that's the real danger here, is looking at how this region, particularly North Africa, has transformed over the last decade, and relationships have transformed over the last decade. And Libya is just the perfect example of this, because it's caught between 2 winds blowing across North Africa and the Middle East. And it's the Arab Spring. So it's this, let's liberalize and democratize on the one hand, versus let's have security and stability and authoritarian rulership on the other. And that's not only is it exposing the fault lines between these 2 different winds, because Libya is split literally down the middle between Eastern Libya, that is led by the authoritarian clan of the Libyan Arab Armed Forces, versus the government of national accord, civilian government that aspires to have democratic elections later down the year, but also their relationships with different countries. So Egypt, for example, backs the Eastern Libyan strongman Khalifa Haftar, and does not have any open relationship with the government of national accord today. So when we're looking at numbers, how do we even know what's going on in Egypt when we can't kind of coordinate with each other? The government of national accord, for example, in Western Libya, has a better relationship with Tunisia, and has sent over the Minister for Public Health, to begin to assess whether or not they can donate to that fund. I mean, moving forward, I would say that Libya, again, because it's a very rich country in Africa, it was one of the founding members, or the founding member of the African Union, can really begin to lead the efforts, at least financially, given that it has a small population, and it will become the host or the transit and migration point for hundreds of thousands, if not millions, of people from across the continent who may either be fleeing from the spread of disease, or also be fleeing from conflict, from poverty, and from the effects of conflict. Now, this is one area where Libya could probably play a leading role by offering that money. And listening to Professor Hendricks earlier on, knowing that the numbers are rising in sub-Saharan Africa and in South Africa, we can think that those numbers will begin to pull up and push up into Libya. So it's one of the areas where you need that regional cooperation. But that difference is not only exacerbated by the fact that we're in different regions, but it's that because we have different forms of governance. And I would say, and I think this is really important for those that are watching North Africa, it's that the authoritarian rulership are really going to come under an immense amount of strain because of this, because they view COVID-19 as a regime maintenance threat. They view it as something like this. Now, only in the last week, the head of the COVID-19 committee of the Libyan Arab Armed Forces issued a statement threatening to pursue anyone that challenged or criticized the handling of the crisis in Eastern Libya. So if we don't have an open channel of communication between our government and our governed, if we don't have an understanding from the government about how we can kind of move forward and cooperate together, if we don't have that cultural kind of nous and being able to grasp this, I think we're going to face a massive struggle. But also, because there are different kind of governments, like Tunisia, for example, is a democratically elected government, Egypt isn't, how are they going to communicate? How are they going to know who's reporting accurately the figures? I mean, it goes beyond just the idea that we have relationships. It's the kind of relationships that we have. And those inequities are going to be exposed in the coming months.
Thank you, Anas. Now let's go over to Reverend Eugene. Same question on regional cooperation. Thank you.
Yeah, on the regional cooperation here in West Africa, it's ECOWAS. And within ECOWAS, I discovered there is an internal organization concerned with health. They have been doing, at least from the numbers, quite proactive. They have provided more than 10,000 medical equipment and put aside almost 740,000 chloroquine, but they are also helping the member nation, the 15 member nation, trying to procure what they need. And I read that they are really ordering more than 240,000 kits for tests, 250,000 lab kits in order to carry the text, and also almost, but this is very slow and very small, for the 15 nation, 120 ventilators in case. That is a regional solidarity. And then you have also UEMOA doing something. What I discover is a really new type of solidarity coming around. The state here has created a fund, or tried to make it possible, a humanitarian fund, where they hope to contribute, calling for the partners to bring in money, private sector as well as individual. And I would say there have been quite a number of states, the US, India, and others, the African Development Bank, who are really jeering to see what they can do to make it possible to lower the burden of this pandemic.
Thank you, Reverend Eugene. Professor Hendricks, over to you on the regional cooperation question.
Okay, just very briefly, because South Africa is chair of the African Union for this particular year, and I think it's working through that particular organization to ensure that all African countries are being taken care of. And I think this time around we can really commend the African Union. It was quick to actually see the threat coming. It closed down the AUC very early on, about 2 or 3 weeks ago already. It put in place a solidarity fund. It has a COVID-19 strategy in place already. It has a dedicated website where you can go and see what's happening in any of the countries across Africa. And then it is providing technical assistance as well as the necessary equipment. So I think South Africa is working through that particular organization. Our president also wrote to the WHO to give support, and this time in his capacity as chair, of the African Union, to give support to the Director General, who we all know has come under quite a bit of attack recently. The African Union has also put in place task forces, plural, one in each of the 5 regions through which they will work. So I really think South Africa has put its efforts in the African Union, but just closer to home here, obviously a country like Zimbabwe will need PPE, for example. And many of the countries the people in the countries in the region in Southern Africa use South Africa, the health facilities. So what I have seen our governments do is to open up our borders so that people who need to access our health facilities can actually come in on that score.
Thank you, Professor Hendricks. And lastly, let's ask Father Alain to address the question of regional cooperation. Over to you, Father Alain.
Yeah. Okay, thank you. I will not come back to what the African Union is already doing because it's almost the same I wanted to say. On the part of DRC, you know, we have 9 neighbors. The country is big with 9 neighbors. And this particular crisis can only be fought through, I would say, common efforts put together. We cannot work in a silo, and that will not actually have long-lasting impact. And what's lacking, apart from what is being done on the African Union level, is on a regional level. I'm not seeing very much on that, on the management of the coronavirus virus crisis, as compared to what is being done, for instance, in other regions like East Africa or West Africa. And that's the particular problem of the Central African region. There's not the regional aspect of the region is really not being taken like care of. So apart from the African Union, on the regional level, I'm not seeing really much being done by the country and the region. Thank you.
Thank you, Father Alain. I understand that our next question will come from Congresswoman Jane Harman. So we will link her in by voice and we'll hear a question from her. Over to you, Congresswoman Harman.
Thank you, Mike, and thank you to the panelists. I think this whole program is fascinating. As I listened to you, I realized how different are the 54 countries of Africa. You're only 5, but as you even answer Mike's question about regional cooperation, how different are the regions? And my question is about the broader context. In addition to the challenges of COVID-19, you face, especially those in North Africa, the challenge of terrorism. You face, especially in Southern Africa, the challenge of the youth bulge. You all face climate challenge. And so I guess my question is, I don't want to depress this audience, but I think all of you are capable of thinking in a broader way. In addition to COVID-19, will you have capacity in your countries and your regions inside Africa to be handling the other things that are coming at you at the same time?
Thank you, Jane. Why don't we go to Dr. Jonas first, and if you can just take a quick minute to address that.
This particularly climate issue, we had this conference very recently, how extremely demanding it is. Currently, locust is hovering around the Horn of Africa. Again, that El Nino effect, and again, this land degradation, it is compounded together, and it is very difficult, if not impossible, for only one country to tackle. It necessitates definitely regional integration, even more than that, global coalition, to be honest.
Thank you, Dr. Jonas. Anas, can you give us a quick comment to address Jane's question, please?
Yes, of course. Yeah, I think it's, you know, we have these dual challenges today, really, that focus in on when you're looking at Libya. So the terrorism challenge is quite a well-known one, and the migration challenge. And I guess the way to look at this really is, how do, you know, nascent governments respond to this whilst keeping their governments and their country resilient? And I think there's a temptation at times to use this as a regime maintenance tool to reframe the social contract. And I think this is really a litmus test. And I think so, something along the lines of terrorism before you can use to take power, and it has been the case in Libya where governments acquire legitimacy from the international community by saying, here, look, we can fight this, we can fight ISIS, or we can stop your migration problem. But COVID, it's such a potent threat that this is really going to be the litmus test. Either you're up to the challenge or you're not up to the challenge. And I think it exposes those difficulties for governments that like to talk the talk but can't really walk the walk. And I suppose that's really where Libya is today. Yeah.
Thank you, Anas. Let's go next to Reverend Eugene on the same question, please.
Is very important. The question of climate is quite important. And in this part, I would say one of the challenges that come on top of COVID-19 is all the efforts of Côte d'Ivoire, Burkina Faso, Niger, Mali, to come to terms with the situation of security that is really getting worse and worse. And so the situation of security also are moving people from their villages, they are running down, and there is a new pressure, even on the environment, stemming from the very difficult regional crisis. If you read what is going on in Mali, the number of soldiers killed, Burkina Faso, Niger, Nigeria, Chad. So I really believe that these come on top and really require more resources. The resources that are already devoted to those issues cannot be put apart, while in the same time the need to invest on the new challenge of COVID-19.
Thank you, Reverend Eugene. Let's go to Professor Hendricks on that same question, please. Over to you, Professor Hendricks.
So violent extremist groups have not gone into lockdown. Can you hear me? Sorry.
Yes.
Violent extremist groups have not gone into lockdown. They are still out there doing what they do. We can see that in Mozambique, we can see that in Burkina Faso, etc. Climate change continues, and so does the youth bulge. But I think that in Africa, we have always been dealing with multiple challenges at the same time. This one is no different. I think that we have learned to deal with these challenges on a more regional basis. So, for example, dealing with violent extremism, we have a number of regional mechanisms, the MNJTF, G5, etc., that have been set up. So too for climate change, we can look at IGAD. And now too, with COVID-19, we are seeing a broader continental response to this. And I think that this is the way to go. Everybody realizes that we cannot have national responses to these particular crises.
Thank you, Professor Hendricks. And lastly, let's go to Father Alain on that same question. So over to you, Father Alain. Thank you.
Yeah, okay, thank you very much. And as I've been reflecting, I think one of the things that the coronavirus crisis has shown us is that we all live in the same universe and we share the same humanity. So some of the challenges or things we really need to face them together. And that's why I will really advocate for, at least for the Central African region, to foster the regional way of handling our common challenges, to foster the regional integration. And that, I think, is something which is really lacking in some of our regions in Africa.
Thank you, Father Alain. What I'll do now is we have some questions coming in from our online audience, and I'm going to pose some of those questions, and I'll ask a specific speaker to address each one. And I'm looking at, oh my gosh, there's so many here. Okay, I'll start. Our first question is from Richmond Commodore. He's actually one of our SVNP scholars from the country of Ghana. And he has a question regarding COVID-19 in West Africa and the lessons learned from Ebola. So I'm going to address this question first to Father Alain and then to Reverend Eugene. So Father Alain, the question is, in their quest to stem the spread of COVID-19, what relevant lessons or strategies did African countries learn from the playbook of the most recent Ebola epidemic in the region? So if you can take a minute or two on that one, Father Alain.
Yeah, as I started by saying that the country, faced the Ebola crisis before this Corona one. And the Ebola crisis in DRC, the eastern part, made more than 2,000 people, victims, people who died of Ebola crisis. And as compared to the Corona crisis currently, I think for the case of DRC, the Ebola crisis was managed in a better way. Okay, at the beginning, the government was hesitating, and until they put up a team of experts led by one of our best biologists, who is actually the one also leading this Corona one. And that team made a very interesting work. The approach they used in the eastern part of the country.
Okay.
But the thing is, maybe the contexts are different. Now the crisis is in a very big city, Kinshasa, and the eastern part of the country, it was easier to contain the crisis there. But the team did a very good work as compared to the way the coronavirus is being managed.
Thank you, Father Alain. Over to you, Reverend Eugene, the lessons learned in your region from the Ebola crisis.
The crisis has really bring out within the region, this really I believe, a sense that we belong to a region. When it started and things went from Guinea, Liberia, and then we are moving to Côte d'Ivoire. So people were very conscious that if nothing is done in cooperation, it will not work. And when they first find the first case in Nigeria, it was very alarming because of the movement of people in ECOWAS. I think the great point in ECOWAS is this capacity of people to move freely. I don't need from Benin a passport to go to Senegal or to go to Mali or to go to Ghana. So people travel a lot, and this capacity to move remain a greater challenge for now, because Ebola, you know that it's a corpse, you won't touch it. The full definition of the way of transmission were better known. But now with the coronavirus, the ways of transmission are not always as clear as it is. And so it kind of put more pressure on people to know how to be safe as people are moving, people are living together in very close, tight environments.
Okay, thank you, Father Eugene. Our next question is from Hannah Akoibo, who's from our team. She's part of our team here at the Wilson Center in Africa. Her question is about the impact of the coronavirus on democracy in Africa, especially with respect to upcoming elections. So I want to address this question to two of our speakers, first to Dr. Jonas and then back to Reverend Gusekinde. So Dr. Jonas, the August 2020 elections were a big benchmark in Ethiopia's reform agenda. And Prime Minister Abiy has just announced the postponement of the election. So what are the implications of this postponement for governance, peace, and security in Ethiopia? And what measures are the election board and the government taking to ensure transparency and readiness for elections in this coronavirus pandemic environment?
I think this is in line with Article 93 of the Ethiopian Constitution, that if there is a crisis, national crisis, such as COVID-19 or war or just similar things, earthquake, then there is possibility of postponing. So it is responding to what is already entrenched as legal system. At the same time, of course, the process of maybe building democracy as well as responding to people's demand. And this postponement has been time and again, of course, raised by different opposition parties, that the time was very, very limited. So it should be extended. They were just raising, and it's a sort of coincidence. So in the governance aspect, I think it seems to be addressing some of the voices which have been already there at the both grassroots level and of course at the middle level. So as to maintain credibility, transparency and responsibility of the NAB itself, the National Electoral Board of Ethiopia. I started talking to opposition parties, again gathering ideas from them in the civil society, as well as, of course, the media, and through media also reaching the people, whether that postponement really gives time for people to reorganize themselves. For instance, at this time, they should have been organizing subcommittees so as to oversee how the election is to be conducted, where it's fair and free. And so there was no committee set up because of the coronavirus. They all locked down, as the professor was talking earlier. And people already, because they had their movement is so restricted, there is no way for them to go out. They really must be given a chance. And so it seems to be responding to what is on the ground. And I think then it should, in terms of peace and security as well, if you simply went on, then you are sacrificing human lives, which is part of human security. So to my understanding, and of course our own observation shows that both NAB and the government itself seem to be responding to what is already available, what is really shouting for solution.
Okay, thank you, Dr. Jonas. So let me turn next to Reverend Eugene with the same question. In your case, Reverend, in your country, Côte d'Ivoire, general elections are scheduled for later this year. First question is, do you think the elections will continue as planned, or will they be postponed, and what are the implications? Second question is regionally. There are currently 7 West African countries scheduled to hold elections this year. What are the likely impacts of COVID-19 on the larger democracy picture in the West African region? So over to you, Father.
Okay, thank you. The political landscape in Côte d'Ivoire is very fluid these days. The coronavirus has been taking energy, but politics is still on. I think that there have not been yet significant, signs that would indicate that the October 31st election would be postponed. Not officially, because only yesterday, after the minister council met, they have proposed, the government has enacted a new electoral code, trying to bring the revision of the constitution in line with the coming election. So that means there is no sign that it may be shifted. But as things evolve, I don't think that if the situation of health continue to prevail as it is, they may have to review it. But on the actual situation, the perspective of having the election is maintained. And people are trying, politicians are trying to not take advantage, but take also the opportunity to be generous in terms of providing help, support to communities and others. But a good idea came, people say, we should not mix up politics with the challenge of health at the present time. Now, what is coming as election in the future are very challenging because There have been here and there some attempts to revise the constitution. We did it here, but it goes through the parliament. And Togo moved, and now we have Guinea who also move and make some changes. I think people are not always happy, and Guinea has gone moving forward and having his election. Mali did have some local election in spite of how we call it, the coronavirus. So my sense is that the presidential election are much more serious, and people need to campaign. They need to go around the country, and here most of the election that will be coming after the end of October, November, and December for some of them would probably be maintained.
Okay. Thank you very much, Reverend Eugene, for those thoughtful comments. The next question is from one of our audience members, from Ni Akuete, who's a longtime friend of the Wilson Center Africa program. I think many of you know him. And Ni's question is, what is Africa's perception of help from the USA contrasted with, for example, China or the EU? So on this one, I'll look to the speakers. Who would like to tackle that one first? If you can just raise your hand, I'll unmute your microphone and you can take a minute or two to address this. Who'd like to go first? Okay, we got Anas. So Anas, the floor is, hang on, yeah, floor is yours.
Thanks, Mike. I think it's a fascinating question because it really shows how, at the very least now today, China's muffling of the actual pandemic in the early days, gagging public officials, doctors, and frontliners, and it's kind of transformed its position today, having 3 months ago been really at the heart of this crisis and one of the sources of its spread, to today being looked at as a model for the way to respond to this. So China's actually offering a lot of support in North Africa, to Egypt, to Libya, I think even to Tunisia as well, in offering to send over some supplies. In recent days, they have sent over a delivery of buses for some reason in Libya when everyone's supposed to be social distancing. So I'm not really sure of the reason why they delivered on an order of that size, but they've given over to EU countries a number of face masks and ventilators. But also it's the response. It's the idea that the authoritarian lockdown in China was the way to answer this. And I think that's really where some countries are kind of in this kind of, this mix is binary. Do we go the authoritarian way of China, lock everything down, and that's going to keep us safe? And how will our citizens respond? So in North Africa, they've started to do this, but they don't have a welfare system to kind of hold them. They don't have a welfare system to keep them at home for more than a couple of weeks before people either are too poor or too hungry and have to start leaving and finding food or finding a way of guaranteeing themselves some income. And I think that's really where China's response looks good in the early days and looks old in the others. The US response has been, I think in Libya, to offer around $6 million in funding. But really critically, the US and North Africa has the ability to actually stop and sanction, and if not use coercive means, to stop many of the actors from continuing the war. And regretfully, it hasn't done that. And that's one of the major issues with the US response. The EU's response actually has been to offer Operation Irini, which I can speak about for just a very, very short amount of time. Operation Irini, I think, is really a moral stain, and it will come to be viewed as this in the coming weeks. The Danish Refugee Council has responded as this is the naval operation that is on the shores of the Mediterranean between Libya and Europe, and it's carefully designed, in their own words, carefully designed to not save lives. So it's there to stop one form of assistance in the civil war, but it is making sure that it doesn't assist anyone fleeing from conflict in Libya or fleeing from conflicts or poverty in Africa. And I think that's one of the major problems that we have today, is that would never have been passed without the scrutiny that would normally happen, but because of COVID-19, that scrutiny is no longer there. So I think that's a major problem with the EU's response on Libya and North Africa.
Okay, thanks, Anas. Let me call on Dr. Jonas to address this question as well about expected response among Africans, response from the US, from the Chinese, from the EU. So Dr. Jonas, over to you, please.
Much indeed. I just believe that context is key in any social science analysis. And by the way, there is rain here. If it is echoing, I'm sorry for that. So to me, I think cultural differences must be celebrated. That's my view. We can't have one size fitting all. And China has its own way of governance, and we have seen globally, particularly in 2008, how China managed to completely control that crisis. And now, again, as we can see, the coronavirus, the whole world is just witnessing. I think for Africa, then, fine way is most of the time cooperating both ways with West as well as East, as long as Africa's. And we always have been definitely with wound in the scar, in the mind of the world, is that Libya's suffering today is not really because Africa failed, because China failed, but I think it was not properly handled in the Western aspect. Most African Union countries were opposing the intervention in Libya, but finally we see what's happening. So honestly speaking, we are very happy to work with both America, European Union, as well as China. So we welcome from whichever it is. And we are very happy to, the principle we have is peaceful coexistence, working with all of them, and let's focus on that. I'm sure you might have heard some scientists saying that this coronavirus must be tested first in Africa. I think it is an insult for human intelligence. And these things must have been definitely challenged and confronted at the same time, as was Southern Voice. So such things, when they come up, then as Southern Voice, as with the Wilson Center, must really say something about that one too. So I think it is good to keep respect human dignity, human respect, and collaboration. It is that's the way for us to really deal with this coronavirus, and cooperation and unity. Not really isolating and looking down on others and denigrating. That's what I feel.
Okay, thank you, Dr. Jonas. We have so many questions coming in, and we only have 8 minutes left before we have to end our session. So I'm actually going to take the liberty of asking the last question and posing it to each of you. I'm not sure if we'll have a chance to get to everyone, so I'll start out of order, and we'll start with Professor Hendricks. This question will be on the economic impact of the coronavirus pandemic. Starting with Dr. Hendricks, can you give us a sense of the short and long-term economic and development outlook for your country, and what measures is the South African government taking to cushion the country and South Africans from the very likely recession that's ensuing from the pandemic? So over to you, Professor Hendricks.
Thank you, Mike. I think that the current lockdown may, as they say, flatten the curve, the medical curve, but everyone is indicating that it is actually going to deepen our economic recession. Moody's, you may have heard, has finally downgraded us to junk status in South Africa. We've been going on about this for the last 2 years. That call came in about 2 weeks ago. We see our rand dollar exchange now at 20 rand, which is like an all-time low to the dollar. Our economy is shrinking further and further. We simply don't have sufficient rands, which is our currency, to deal with this particular crisis. We can't offer the kind of stimulus packages that the United States, for example, is offering. We don't. Our government does not have the kind of resources to do that. It has tried to introduce some measures to cushion society here. For example, a solidarity fund. These are the typical measures. A solidarity fund, this is where people voluntarily contribute to that particular fund. A temporary employer relief scheme. Banks have given what they're calling 3-month payment holidays. There are numerous subsidies for the agricultural sector, etc. But this money, I think, will not reach those that most are in need of it. For example, our gardeners and our domestic workers, there are about 1 million people in our country here. They are not going to be paid by their employers. When we're looking at Uber drivers and hawkers, etc., this money is not going to reach them at all. No unemployment scheme, because they are not part of that unemployment insurance fund, is actually going to get to them. So for Africa as a whole, not just South Africa, our biggest sector is the informal sector, and the measures that are being introduced are actually measures more attuned to the formal sector. And so for the informal sector and the larger population, it is more the ameliorative measures, food parcels, etc. That simply won't cut it, I think.
Okay.
Thank you very much. Lump sums for us. I just want to end very quickly by saying that we faced structural challenges in our economy prior to COVID. COVID has now exacerbated it. And coming out of COVID, we are going to have to deal with some of the structural challenges, which is a bloated civil society and dysfunctional SOEs in our country.
Got it. Thank you very much, Professor Hendricks. If we can jump next to Father Alain on the same question about the economic impact in your case, the DRC, and how the government is dealing with it.
Yeah. As a professor has just said, in DRC it's the same way. The informal sector in DRC is the real driving force of the economy. And the measures, the current measures of lockdown, like closing everything, are very hard. Especially when the government is not proposing any substantial thing in exchange to the measures which are being put up. They are not. The government is not proposing anything in exchange because they haven't. The government does not have the means to like inject the money to the informal sector after the coronavirus crisis in order to help them boost or stand up. The only measures they've taken so far are, I would say, with a social impact, like the people are not going to pay for electricity for the coming 2 months, and electricity and water. But as you know, in DRC, more than 50% or 60% of people don't even have that electricity. So all those measures are not measures which really can help the economy to stand up and to improve after the coronavirus. The government has already communicated that the macroeconomy was supposed to grow by 5% this year. Those were the projections, but now they are down to something close to 2% or even less if we continue this way.
Thank you, Father Alain. Let's jump to Reverend Eugene on the same question. If you, we can give you a minute and Anas a minute and close with Dr. Jonas. So if you can give us 60 seconds on this, thank you very much.
Here, really, I think that the economy is going to take a toll, and the government knows it, and a number of measures has been taken, like lowering the gas price, delaying the payment of electricity and water, and for some very lower group, simply to cancel it, and really anticipate a kind of dialogue with the private sector. They are trying to talk about it to see how they can mitigate what happened. The main challenge for the economy as its implication is on the social. There is a relief fund. And as I said before, how is it going to be dispersed? And the criteria, are they transparent? There are two major decisions taken. There is one on solidarity that is almost 2.8 billion, and informal sector sustainability fund, which is roughly a little more about billion also. So the challenge is now, first, where are they taking the money, and how are they going to pay back if they are loans? These are totally another question. Our countries depend most of the time either on partner in solidarity, or then they have to look for money in, how to call it, from banks and others. And that will be after the COVID. I think we have to reflect on diversifying our economy, on reflecting on what type of developments we want for the future of the continent.
Thank you, Reverend Eugene. Let's go to Anas for 1 minute and Dr. Jonas for 1 minute, and then we'll have to close it up. So Anas, over to you.
Thanks, Mike. So very briefly, Libya is actually already a rentier economy. So that means that we already supply and provide for the majority of the citizens through a public welfare system, or almost a job as a public welfare system. So most of Libya's economy, the public sector at the very least, is kind of protected. They'll be getting salaries into their bank accounts. The problem today really is that there's a liquidity crisis. We can't get money out of the banks physically, and we don't have a sophisticated kind of a credit card system or electronic payment system in the country. So that's a problem. So people will still have economic difficulties. The private sector will most likely collapse as a result of this, and I think that's going to be a major issue. The government's source of income, basic source of income here, over 90% of the economy is from the oil sector itself, which has been blockaded now for 2 months. And Russian Saudi oil war at the moment that has driven the prices down will also harm it when it comes back online. So I think the long-term perspective here is that it's not going to look good for Libya. And I think it will exacerbate something else, which is anti-corruption measures across North Africa. Citizens in Libya especially, but also elsewhere, will want to know where that money the government has, where it's being spent, and whether or not it's being invested in the healthcare system, because that's what they really want to know. It's not enough to pay me a salary. They want to know that the money is being really used properly. So this could be the second kind of Arab Spring moment across North Africa, and especially as numbers rise in Algeria and Egypt, it could really exacerbate those current crises. So I'd look at that as well.
Terrific, thanks, Anas. And finally, Dr. Jonas, I know a minute's not enough to address this question, but please give us as much as you can in 60 seconds on the economic question.
A day ago, a journalist asked one of African leaders to find out how many people were affected in his country by coronavirus. He said none, and said, "Well, how come?" Well, we don't have any equipment to test. Why not? We have no money to buy it from there. Already from the very outset, you just can sense how much it has affected. The effect on economy is so devastating, to be honest. Because the preceding brothers and sisters have already been speaking very eloquently. I don't really have to spend time on the structural problem, how it is going to affect long-term as well as short-term. I would rather like to focus on the way out. I would be very happy if multilateralism is back again. If we can really focus on the governance aspects in Africa. Most difficult thing for us in Africa is not economy, not even coronavirus, but governance, seriously speaking. So if we can focus, if we can improve our political governance, economic governance, the entire governance structure, then I'm sure we'll be back on track. Thank you very much.
Great, thank you, Dr. Jonas. I'm afraid we've run out of time. I'm sorry I didn't get to so many of your excellent questions, but what a terrific event. We have 340 live viewers, and I want to thank each and every one of you for tuning in and taking time away from your duties and your families during this pandemic. And I particularly want to thank our 5 speakers from our Southern Voices Network for Peace Building. Again, we had Dr. Jonas Adeto, Executive Director of the Institute for Peace and Security Studies at Addis Ababa University. We had Mr. Anas Algomati, Founder and Director of the SADC Institute in Libya. Reverend Eugene Gosakinde, Director General of the Center for Research and Action for Peace in Côte d'Ivoire. Professor Cheryl Hendricks, Executive Director of the African Institute of South Africa at the Human Science Research Council in Pretoria, and Father Alain Anzadi, Director of the Center for the Study of Social Action in Kinshasa, DRC. Thank you all. Everyone, please stay safe, stay close to your families, stay distant from others physically, but not socially. And we look forward to another event, and we hope we can do one in person very, very soon. So thank you all. Signing out. Bye-bye.